Go.
My name is Caitlin Connor, and I'll be giving my final presentation on assisted suicide. What is assisted suicide? Assisted suicide is the suicide of a patient suffering from an incurable disease, affected by taking lethal drugs provided by a doctor for this purpose. Do we have the right to end our life when it is the only light at the end of the tunnel? Shouldn't it be our choice to do what we want with our bodies? Assisted suicide is when a terminally ill patient gets a doctor to aid in the process of killing them. Debates go back and forth on whether or not a dying patient has the right to end their life. People are against it and people are for it. Those against it are against it because of religion and moral reasons. Those for it are because they have compassion for the ill. Terminally ill patients who are in the final stages of their life request for a doctor to aid in their killing. With active euthanasia. These patients are in agony and pain, and they feel like they are brought to this place in which this is the only way to end their suffering. When others see the word euthanasia, people view it as murder, while others just realize that it is the act of putting someone to death painlessly, or allowing someone to suffer from a painful condition and withholding them from ending their lives to stop the pain. The freedom to live according to one's beliefs and choices is celebrated in the United States. Terminally ill patients who wish to choose death with dignity versus a painful and agony end often face an enormous challenge, even with getting life-ending drugs. Denying mentally capable individuals the right to end their lives in a peaceful manner is a denial of their individual rights to self-determination and the rights to the self-choice. The only states in the U.S. that allow medically assisted suicides are Oregon, Montana, Vermont, New Mexico, and Washington. The rest of the country, assisting suicide is a crime. The laws that criminalize assisted suicide are intrusive and unfair to terminally ill patients and their families. Patients then have to live with the diagnosis, and secondly, they are left with a burden on their loved ones of having to make the choice of ending their suffering, which gives them a cost of exposing them to the threat of prosecution and jail time. Assisted suicide provides a valuable life service and provides safeguards for those wishing to end their own lives. Allowing doctors to assist in suicide provides a means of oversight. Moreover, a doctor's assistance will ensure success, thus eliminating the fear of serious injury without death and a lack of suffering. For some people in chronic pain or with terminal illness, suicide is the only ethical end. After studying both sides of the issue, an individual must conclude that terminal patients should be given the right to assisted suicide in order to end their suffering, reduce financial hardships, and to be able to preserve the right to determine their fate.